Today we're with Dr. Natalie Hartenbaum to update us again. Dr. Hartenbaum, as you recall, is President and Chief Medical Officer of Occumedics. She is an occupational medicine physician and former president of the American College of Occupational and Environmental Medicine. Doctor, thank you for joining us today.
Thank you for inviting me.
Absolutely. Doctor, if you could give us an update since our last talk, let's start with New York City. How it affects truck drivers, any of the regulations or guidance from the CDC.
When we last spoke, the CDC had recently issued some guidance indicating that truck drivers and other essential personnel are not necessarily required to abide by their recommendation of the 14-day quarantine if you were in New York City and then leaving your greater New York City area. I think there's been a lot of confusion about that since then, where some examiners, I've been told, some other individuals are advising truck drivers who had been in New York, you must quarantine for 14 days.
In fact, I emailed you with a question where a driver ran into that over the weekend.
Exactly, and we're trying to communicate to our examiners.
Yeah.
What CDC has very clearly stated, what FMCSA has come out with a very similar statement, and interestingly, CDC took down their original very detailed statement of what drivers should do and replaced it with a much briefer statement, which basically says those essential workers who are going into and out of New York City, who are going into and out of those areas with high risk, are not required to self-quarantine. They are required to certainly maintain social distancing, at least 6 feet. They are expected to maintain good hygiene, washing their hands on a regular basis and not touching their eyes and nose and mouth. To be certain that if they are touching other items, whatever it might be, receipts, packages, anything like that, even though packages are not really high risk, they should wash their hands on a regular, frequent basis. The other new recommendation, of course, is, wearing masks. And I hope none of you on the western side of Pennsylvania are offended by my gritty mask. But masks are really meant to help protect you, others from you. A large number of individuals who have COVID-19 are asymptomatic or minimally symptomatic. So you very probably are out there in the community not recognizing that you can spread the disease. There's reasonable evidence right now that can spread up to 2 days prior to before a person becomes symptomatic. So the use of your mask will prevent you from coughing, sneezing on others, producing those droplets, that aerosol that may end up infecting others that are around you. So certainly wear your masks. The one caveat is there are some local areas that are still saying you must quarantine if you come into our area. It is consistently said that those essential workers do not need to abide by those rules unless the local ordinances are very strongly saying you must do that. And I think most of them understand if they don't allow those essential workers, whether it's truck drivers, whether it's railroad operators, whether it's electricians, whether it's any other service agents from coming in, they're going to have a problem.
Absolutely. Doctor, how about drug and alcohol? Any updates or any new developments since we last spoke last week?
Well, ODAPSI still came out with the guidance of an understanding, certainly continue with the required testing. Certainly you can't put somebody to work who doesn't have a negative test for pre-employment or for return to duty. There are lots of ways that you can work within the regulation for random, for follow-up. A lot of it is documentation. What has recently changed is some guidance on substance abuse professionals and MRO and substance abuse professional recertification and training. The SAP is supposed to be conducting a face-to-face in-person interview. Again, recognizing this is a very unique situation, ODAPSI has said that as long as the interview is conducted at least virtually face-to-face, at least the interviewer, the SAP, has made reasonable efforts to ensure that they have good communication, they have good internet access, that they're reasonably able to interact appropriately with the individual to do that thorough assessment and document how that interview, that assessment is taking place. That would be acceptable. The other big announcement was that a lot of SAPs and medical review officers may be coming up for recertification. Again, recognizing that there may not be the ability to recertify. Some recertifications can be done online, some can't. Some medical review officers are just so swamped with patient care or system care that they don't have the time to do the recertification. And ODAPSI has indicated that in these cases, the provider, the service agent, would not be found substantially non-compliant. So in other words, it's not going to be a, you've done bad. It's a, yeah, you got to fix it as soon as you can.
Excellent. Doctor, anything new on the physical standpoint?
Just again, the same thing. If the drivers have had at least a 3-month certification that was in effect prior to March 1st, they can continue to operate. The emergency declaration goes through June 30th. They are not required to be recertified. The states are not going to be found not in compliance if they don't downgrade or initiate activities to downgrade a CDL for a medical certificate out of date. Very important, the drivers must have been certified for at least 90 days prior to March 1st. If they have a waiver, the waivers are still being issued. So it is important to apply for that renewal of your waiver or exemption. Exemptions really are what's being in place. And if they need to obtain an exemption, they need to apply for them. FMCSA is still granting them. There were probably a couple hundred announced just this morning in the Federal Register. The FMCSA had announced a planned medical review board meeting at the end of this month on April 26th and 27th. Whether that will happen, whether that will become a virtual meeting is really unknown at this point. The significance is the 26th meeting will look at the seizure exemptions, possibly moving or changing the seizure exemption similarly to what had happened with the diabetes or insulin exemptions. The medical review board will also be looking at the recertification exam and what types of questions should be on that. Refresher training still on hold, still not available, but is being worked on, and examiners have been notified multiple times that they will not be dinged or removed from the registry if they've not completed the refresher training. And then finally, on Tuesday of that meeting, the expectation was to review a revised draft of the medical examiner handbook, which we have been urgently waiting for.
Sounds great. Doctor, besides the time you have for us, what other resources are available for the trucking companies and their drivers out there in this time?
Okay. Certainly going to the CDC, but the CDC has so much information right now. It is sometimes very, very difficult, even for someone who understands the site to track through it. FMCSA has a website, COVID specific. There's the Owner-Operators Independent Drivers Association, the American Trucking Association, the American Association of Motor Vehicle Administrators. All have some really good sites with links to very useful resources for both carriers and drivers.
Doctor, thank you very much as always. And again, as we finish these and conclude these, I'm sure you join me in thanking the drivers out there who are making this all happen.
Certainly. If it were not for the essential workers, we'd not be able to do anything right now. So thank for all of them.
Thank you.